that many of our men are suffering from low sperm count or even zero sperm count as a result of some nonchalant attitude towards having infection and not taking their time to analyze their system and treat the infection as expected from time to time. Yes, you see, there are some things that leads to low sperm count or even zero sperm count. Everything is not limited to infection. At times, it might be hormonal imbalance. At times, it might be some problem related to the testicles from childhood. So, but if it is not those two, then it will be from infection. And if you are to treat the low sperm count directly without treating the infection first, it will just be as if you are wasting your time. So that is why at Asiwaju Elegbogi Herbal Therapy, what we do first is to tell our patients whenever they come to us to tell us that they've been married for years without having kids and the wife is okay, but the husband does not know his status, we tell them to go for sperm analysis test. When they go for the sperm analysis test, it is from there that we will get to know what is really wrong. So if it is low sperm count, part of the test will tell us the causative agent, that is what led to the sperm count being low or being zero. So if it is an infection, we'll first treat the infection, but if it is not infection, we treat the sperm count straight. So it is the test that will tell us the morphology, it will tell us the motility rate of the sperm, it will tell us the color of the sperm, it will tell us the shape of the sperm, it will also tell us the number of counts left in the sperm cells. So if we get all this information, that is what we will now work on. So starting with the infection flusher, we have this is to be poured inside milk that the patient is going to use first. After using this, then we will move on to this. You don't need to use anything with this other than probably water or lime. You pour this in a 2-liter keg, a keg like this, then you pour water to fill it up, mix it together, take one shot at night. Then you will now use this in the morning, 2 shots of this in the morning. This would come this way, we would have mixed it from our point. We don't use alcohol to mix it. We don't use lime to mix it because of people with ulcer. As you know, people living with ulcer can't take anything alcoholic or acidic, and lime is acidic. So we'll mix with water from our own part. After you use this for 3 weeks, then you move to this. These two combo would work for your motility, the shape, the color, and the count itself. You know, as you know, maybe you don't know, let me tell you. When you ejaculate into a woman's vagina, it passes through the fallopian tube to the ovary. From the fallopian tube, there is a number of seconds your sperm would leave before it got dead. So, but if the sperm motility is very low, during the period it has to move to the ovary for fertilization, the sperm would have been dead before getting there. And that means it is dead on arrival. So when the sperm gets there, there will not be anything like fertilization. The woman will just release the egg that's supposed to be fertile with the sperm, and it will just waste like that. So if the motility is very low, this will work on the motility while this will work on the count. So the two work hand in hand. We cannot treat any patient for low sperm count or zero sperm count without asking the patient to go for test. It is the test that will guide us on what we are treating. And that is why Asiwaju Elegbogi is actually different from every other herbal practitioners. What we do is going through critical analysis of our patients and knowing the best solution to give them so that they can maximize every token spent into our company to buy any of our products, because a happy customer would always refer more customers. Thank you very much.